Hello students, welcome to AKS IAS. As part of our mains Q&A series, today we will discuss a question on Smart Cities mission. So the question says, do you think that the implementation of Smart Cities mission neglected the dimension of health aspect? And the keyword is analyze. Okay, so what are the focus areas that we have to answer in this question? Is the implementation of Smart Cities mission and the health aspect, that is a health dimension to it. So, the key points that have to be at your disposal to answer such a kind of question are the newest innovation for optimizing spaces and communities for growth, that is, the Smart Cities mission, hasn't understood the foundational importance of health. Also, looking at the data, only 1.8% of the 5,861 projects which have been sanctioned as part of Smart Cities mission since the year 2015 are for augmenting the infrastructure and capability of health. So, the author states that only 1.8% of the projects are focusing on health and the capability of health infrastructure. This is even lower than the shamefully inadequate 1.6% of the GDP which the states and the center together put aside for health in the year 2019 to 20 budget. So, as you all know, the 2019 to 20 financial budget stated that 1.6% of the total GDP is spent on the healthcare sector. So the author is trying to make a point here that the 1.18% which has been utilized as part of the total smart cities mission project is much lower than the GDP quantum of GDP on which the health spending is taking place. Of the three of the 30 municipal jurisdictions which account for 79% of the cases, 17 are smart cities, and of them only 7 have invested mission funds directly in health. Hotspots like Jaipur and Surat have no health projects at all under the mission. As the mission clarifies on its website, a smart city has no absolute definition. The term, which originated among the Western planners to describe a city which uses Internet of Things data to optimize its services. The Indian Ministry of Housing and Urban Affairs mentions this aspect in only one of the 8 features that it lists for a smart city. The rest of the features focus on urban planning strategies for quality of life, such as of reducing pollution, improving land use, etc. Health is mentioned only in one point of the various, vision document which has been mentioned by the government. Health is mentioned in only one point, which discusses urban identity conferred through local economic activities like making sports goods and hosiery and providing medical facilities. So, in only one particular context, the significance of health has been mentioned in the vision document of smart cities. However, please note that health is an integral component of governance and should not be neglected so as to, you know, gain long-term benefits through this mission. The government of India can order a special purpose vehicle created for the implementation of smart cities to focus on the health aspect. The strategy of smart health is based on providing affordable doctor consultation, reasonably priced Medicare, and affordable diagnostics. So these are 3 primary requirements of an accessible healthcare system. This can be done by converging different schemes of the government existent within the ambit of smart cities mission. Also, there could be consultation through IT platforms for institution, round the clock doctor consultations, which is a unique version of telemedicine that can be designed by establishing an IT platform to match patients and doctors and thus bringing convenience to patients at the doorstep. That is the virtual clinics which are recently in news. They can be utilized for providing this healthcare delivery. Also, delivering affordable quality medicines. Under the Pradhan Mantri Jan Aushadhi Yojana of the Department of Pharmaceuticals under the Ministry of Chemicals and Fertilizers, this can be used to provide affordable and quality generic medicines. Also, there could be a mechanism for delivering affordable diagnostics. Complementing the free medicine scheme, free diagnostic services can also be made available under a hub and spoke model floated by the Ministry of Health under the Free Diagnostic Service Initiative. So, these are the various initiatives that the government can undertake so as to provide quality, affordable, and accessible healthcare to the citizens under the Smart Cities mission. Thank you.